Okay, Kiki with single payer healthcare.
Hi, yes, my name is Kirsten Connolly Bray, and I'm a retired nurse with over 20 years experience in emergency and critical care medicine, and I'm here to talk about single payer healthcare. Now, I've been able to witness multiple systems throughout this country. I've worked in the South, the Northeast, the West, all the way out into Hawaii. And by far, I've worked in the California systems and I've worked in the Hawaii systems. Now, Hawaii had socialized medicine. So when I worked there, it was a great system. It worked for everybody. Everybody got help. There wasn't a problem. We didn't have a lot of a homeless population who wasn't getting treated, and it was wonderful. And I'm here to talk about the things that I've seen also as a nurse when it becomes a profit margin. Okay. Medicine and helping people should not become something where mercenaries should find themselves, and they are.
Right.
I work for a nationally recognized healthcare organization that is on the stock exchange. Um, as a nurse, I wasn't even offered I wasn't even able to buy stock because I wasn't a doctor or corporate. Um, this was actually the last job I had in a hospital. I was supposed to take out the trash. I was supposed to take out the dirty laundry. I was supposed to take out the trays. Now, I, of course, am a very hardworking person and I did my job, but you have to understand that I was working in an open heart unit. I had patients coming out who, with their chests, it was just cracked open. I had with the patients who had 6 different lines going in, and that was 6 different opportunities for bacteria to get in their system. So if I'm going into the dirty room, so is 12 other nurses with 12 other patients, and now I am, without going into my other 12 patients' room, am now exposed to those 12 patients. My one patient with their 6 different lines. As you can see, this is a disaster waiting to happen. And, it shouldn't be that our healthcare should be for a profit margin. It's a shame. I watched as healthcare squeezed me and the nurses, took away our support, took it away more and more and more, paid us less, or didn't pay us at least, the going wage. Certainly, the cost of living was, they barely kept it up. And then that in and of itself is a problem. When I have somebody who's a CEO and they're making $10 million, you know what I mean, off of sick people, you know what I mean. And now the thing that really worries me, it was an article that I read in the New York Times less than a month ago, was an article of how now they're allowing medical debts to be garnished your wage. Before, you were never able to you never had to go to debtor's prison. And now they're allowing these companies to go to attorneys, to take you to court, to put liens onto your property, and to put liens on you, and your wages are garnished if you don't pay a health care bill. Nurses had their own their own wages garnished from the hospital they were working for. Now that's just a crime. I've been working for over 20 years in healthcare, and since the age of 18, I've also been grappling with some health issues that have caused me to have some really hefty health bills, and it's been a struggle, to keep my credit afloat. And it's a shame that I should spend my life taking care of people and I can't buy a house. And this is why I'm fighting for a single payer option. I'm fighting for my patients so that they're not exposed to everybody else on the floor. I'm fighting for me so that, when I come home after a tired day, I can have a house to go to, and all of these things are nice too. But a lot of people, what really amazes me, people fight against this single payer option, say, well, I want my health insurance. Well, I don't know anybody here who's going to their full-time job and isn't paying part of their health insurance, a lot more than they ever had to. I know I'm paying. My last job, I had to pay $400 a month, and they said they were helping me. And I don't know how they were, other than giving me an option to get a platinum plan. And this is a shame. People think that they also, this means also when you go to your doctor, you don't have a deductible. When you go to your pharmacy, you don't have to pay that extra copay. When you go to the ER, you don't have to worry about a copay. It's a shame when somebody has to worry about a $500 copay and they're having chest pain. And they're wondering if they can take the hit. And that shouldn't be negotiable. And there are many people today who are sitting here in America watching in pain and worried, who don't want to go to the ER or don't want to go to the doctor or don't want to get that MRI because they're going to know that their deductible is $7,500 because they chose the cheap plan and they only have gone in $2,000 in their plan and they have 4 kids and they don't know where they're going to get $4,500 for that MRI, who might figure out that they have a tumor that could save their lives early. And this is why I'm a deep, supporter of a single payer. Everybody pay a little bit. Everybody gets to go. In Hawaii, I saw a system run beautifully. A system that supported also women who were infertile, had to have infertility. Hawaii made the insurers. They let the private insurers come in, but there was a state system. And if they came in, they had to pay for women and their infertility treatments. They were very supportive. And, I saw a system that worked. And I think at the state level and in this state, it can work. The Kaiser Permanente system has been extremely successful for decades. All my life as a registered nurse, we had Kaiser Permanente in Hawaii. We had it here. They've streamlined the system. If you get enough people, we can get a really great system out here. We've got a lot of thinkers. We've got all the technology. We've got everything working for us. We've got the sunshine. We got the good weather. People can go out and exercise a lot more. They did. I was reading an article once, and they listed, areas that had the longest life expectancy. They said Japan, Greece, and they also mentioned parts of California. So, with our great weather and everything that we're given, why don't we take that extra move and take care of our people so we can walk down the street and not feel bad, or maybe know that this mental person's going to get some help, instead of utilizing our jail systems, And so I really think that, I think that we've missed the boat on that. People say that we're going to be socialists. People keep forgetting that all of Europe are social democrats. It's 2 different things. The Republicans are screaming, oh, we're going to turn into Venezuela. No, we're going to turn into Norway. And we're going to be one of the happiest states in the country. And that's what I want for everybody. I want everybody should have health care. It is a universal right. Thank you. Any questions?
Well, yeah. As far as I'm concerned, and a lot of the people I work with is concerned, universal health care is a human right, period. And that's how most of the world looks at it.
Right.
As far as, Norway versus Venezuela, well, Norway's not being besieged yet. Okay? I was in Venezuela in 2014 when the siege began. Things weren't like they are now because it had just began. They did have universal health care that was going out into the barrios where it had never been before.
Right.
Ever. When, I'm not going to say if, when California does pass universal health care, which will probably be well prior to our independence, 2 things will happen. One is that we'll get a flood of refugees from the U.S., even if we're still in it, that will say, yeah, I need that. Let's go there. And they'll have that, and they'll fight to keep it. They will be intensely loyal to us. The feds try to take it away. You will never find a more loyal force to fight to defend than, for their own well-being. So yeah, we need it like yesterday. Universal health care.
Yeah, we do. I mean, it shouldn't be. It shouldn't be, an option to go
Right.
to the ER.
Yeah,
You should be able to just go.
or an option to use the ambulance.
Or the option to use the
Or else
ambulance.
have one of us poor rideshare drivers try to
Right.
pretend we're an ambulance.
I mean, and and in all honesty, the Obamacare has, it started covering a lot of people, and it was starting to do really good. And actually, I had been a nurse all my life, and I have had private insurance all my life. And right as Obamacare came in, is a time of my life where I found out I was very ill and I wasn't able to work, and I was able to get that insurance, and he saved my life as far as I'm concerned.
Yeah.
If I didn't have Obamacare, I would have sunk.
Yeah.
I would have sunk.
Yeah. Let me share you an anecdote from my rideshare driving experience. I had to take a seriously, dangerously mentally ill person from this church who should have never, given her to me to take her across Riverside to Kaiser because of insurance issues when this church was literally right across the driveway from a hospital. Right? Yeah, I complained vociferously that this guy just dumped her on me, endangered her, endangered me, because her insurance was over here in South Riverside, and this over here wasn't. Okay? And for no other reason. It's literally across the driveway from where I picked her up.
Well, back in the 90s, they actually had a law that prevented, it was called like dumping, ER dumping, and there was a law against it, and there was a fine.
Yeah.
But the problem was there was no enforcement.
Yeah. And
so nobody cared anymore, and everybody started doing it again.
She wasn't dumped from that hospital. She never made it to that hospital. No. She dumped from the church across the alley from it.
Yeah.
Okay.
Yeah.
And dumped on me.
No, that's
it's a crime.
That's simply outrageous. No, absolutely.
No.
As an emerging physician, general practitioner right now, I'm yet to enter into residency yet.
Congratulations.
Thank you. No, it definitely doesn't make sense to have a privatized format for healthcare. It doesn't make sense. I've studied for the last 5 years in the country of Mexico, and they do have a universal medicine program there, IMSS. I have practiced there. I have seen people that in the United States, had they been diagnosed or had gone to their primary physician here in the United States, they would not be getting the life-saving treatment that they required and that they were receiving while I was there doing my clinical rotations. It's simply outrageous that my grandmother, my grandfather, my mother, I'm able to identify that they have been misdiagnosed, mistreated for decades, that endangers their lives, that shortens their lifespan, that overall decreases their productive years. Because if you really want to get down to the cold numbers, you really want to get down to cold numbers, a healthy society is a profitable society.
It's right, exactly. It's I got back to work. Obama got me back to work. And if I didn't have Obamacare, I wouldn't be back to work. I wouldn't be part of the tax base now. And you're very right that and also I also want to say a side note, very much supportive of the compassionate safe injection sites, safe drug administration sites. Yes.
So are we saying that the universal health care system for California would prevent the endangerment of California lives that's being put on us by the federal private system that we have now?
Absolutely.
I just want to remind everybody that the Californians are overwhelmingly for universal health care. We almost had it passed a couple of years ago, and this guy named Anthony Brandon, after it had passed officials, it was up to him to actually, we were that close to getting it, and he killed it. And he killed it, and we never heard about it again. And I was at that rally at his office complaining and stuff, and he's a Democrat, by the way.
Yeah.
And he killed that thing under some kind of excuse that they
premise.
hadn't reviewed it enough or something. And we were ready to have it 2 years ago, and he's still in office, by the way. And
Well, you know, I think
No,
the
it's time to get 'em out
I
of there.
think the
It's time to get
greatest
'em out of
failure
there.
of the Obama administration is that they didn't get a single payer health care. I think that's the greatest failure. They were right there. They almost had it. You know what I mean? They had the Democrats. You know, they almost had it. And at the end, the pharmaceutical companies and the insurance companies, they came in and they put a heavy hand down.
But I think you also comment to the fact that the federal court system has been used to attack healthcare, that they attacked the individual mandate, the Supreme Court struck it down. It was the federal court system. If we were independent, we would not have a federal court system ruining our healthcare system.
That's why you can't pass it under the governance of the United States. We have to become independent.
We have to become independent because there are people that just who don't want to pay for it.
No,
You know, who think they can pull themselves up by the back bootstraps, but you know what? They don't even have bootstraps.
no, and
You know,
how
they
long
just
have we
don't. They don't even have bootstraps.
How long have we
There's, you know,
been fighting
they're
this
completely
issue?
without
I
anything.
mean,
That's
we
it.
have never been, with any administration, whether it's the Clintons, we have never been close to having universal health care.
No. You know, Hillary got, you know, flambéed for it. Flambéed for it when she brought it up. The only thing she could bring up was the kids. She covered the kids. Bless her heart. You know, she did get that through, that she mandated that federal dollars had to go for kids. But you know what? After that, you know.
And last point, which I love the hypocrisy of this, that every congressperson has health insurance paid for them by us taxes.
Us.
Why would they even want universal? They already have it, and
Right.
then they're telling us we can't have it. It's
Right.
like ironic
Right.
to the you can't even believe it. It's
No.
like, it's okay for me, not for you. You don't get it.
It's
but
too
we
good
get
for
it.
you. We have-
You pay for
We
it.
have a silver tsunami coming. There's going to be a need for health care, a humongous need for it, for the next foreseeable 30 to 50 years with this silver tsunami, with the baby boomers, you know, and healthcare is going to be a really big industry and it needs to be reined in. We cannot have it. It's like we cannot have mercenaries, you know, at the head of healthcare companies. That's just all there is to it. You cannot, you know, if you want to come in and work, you know, really hard, like me and this, you know, doctor here, then go, then you know, that's fine. You know, we'll pay people what you're supposed to, but the bottom line is we're not the reason why healthcare is outrageously expensive. It's the pharmaceutical companies, it's the CEOs, it's the you know, the medical device industries, it's the, you know, the health insurance, you know, it's everything. And it's not because we're asking too much pay. Our portion of the hospital budget is it is nothing compared to what they really need to be focusing on, is taking that money, reinvesting it into research, improving our medical care, and improving the delivery of the system. That's all I
Absolutely
say.
right.
Good luck.